Hello everybody, welcome to my channel. This is your girl Ebony, the Black Butterfly, and you are joining me for my update. Yay! This is our 6-month update, and I did really well. Now it's time to get in the ocean and float and go to the beach, jump in the pool, and do all the fun things that I was missing throughout my healing process. Now, I know a lot of people have been asking me questions like, where did you go? Do you have scars? Do you have pain? Um, it's all the questions that everybody want to know about having breast augmentation or breast implants put in, what type of implants you want to put in, what doctors to go to, how much does it cost, how long did it take you to heal, were you in a lot of pain, things to do and not to do, were you able to go back to work immediately? Like, there were so many questions I was just getting all at once. So I decided to come on to YouTube and answer all the questions that everyone has asked me and give you like a real live minute for minute understanding of what it is to have a breast augmentation. Now, I had my breast augmentation done in Houston, Texas, which shout out to Dr. Doe. He is my favorite doctor in the whole wide world. He was very understanding, very patient. I was very nervous. I was nervous the day before. I didn't sleep the night before, the week of. I was just nervous all the way up until, and if you look at my earlier videos, I think you can kind of tell that I was really nervous because I was kind of talking to myself in one of the videos. But for the most part, all that they say, they make you, after you've secured your appointment and you paid your deposit, you've paid your fees, you schedule your consultation first, then you talk to Dr. Doe, you give him your pictures, he'll ask for them all online. Then once you come in for the time of your surgery, I came from out of state, so everything was same day for me. And I did a consultation the first day, and then the next day I went back, and then that was the day of my surgery. Now a lot of people know that being a cannabis girl, you can't do any smoking prior to your surgery. And if you do have a surgeon, I recommend everybody talk to your surgeon and then talk to your anesthesiologist, the person that is putting you under. Let them know what your honest day-to-day life routine patterns are. Don't hide that part from them. It's not that they won't do your surgery, it's just don't hide that part from them. And they do UAs anyway. Most doctors' offices that are getting ready to do a type of surgery for you, they do give you a drug test. So make sure that you are aware of that. Nervousness. Are you nervous? Yes, you can always be nervous because that's something that is natural. You are deciding that you want to have implants done. So it's going to be something that will make you nervous all the way up until. Dr. Doe was very patient with me. Like I said, he put me to sleep in the most beautiful way. I think he was asking me about my life, my job, my career. What do I do? And before I knew it, I was asleep. It took him about 45 minutes to do the entire procedure. And in 45 minutes, I was awake. The pain I did not feel because he made sure I was very comfortable from the type of medications that I was prescribed the day before my surgery, and also the type of medication that he gave me during my surgery, and then the ones that he gave me to take care of me after, which I believe I was given hydrocodone, and I was also given Motrin, and also given scar gel. I was also given some other little things that you could, my bra, that they also give you a bra there that's included in your like your fee, unless you don't want any of those things, and you can get them from like Walmart or Amazon, or you can get them from Walgreens. The surgical soap, it is a blue, it comes in like a blue bottle, and it's like a pink looking liquid. It's a surgical soap that you'll need to get, and that is something that you can talk to your doctor about and have those things removed: the bra, the shampoo, and the gel or ointments. But the vitamins and the day surgery pills and the ones that you're gonna have to take after, you're gonna want to take those from him. There's like a homeopathic pre-surgical medication to help reduce swelling. So you want to make sure that you do take those medications. Other than that, day 2 was the day I did not feel any pain. I was feeling really good. I could move my arms, but I couldn't like do like a over the head type thing where you were like waving your arms like this. It was certain things that I couldn't do. I couldn't move my arms past this point. I could put on my own clothes and shirt, but they do recommend that you bring a dress, because if you don't bring the dress is something that you can like slide on easily and not have to really lift your arms or maneuver your arms. They don't want you to injure that suture underneath or that scar underneath. They don't want you to aggravate that in any way for the first 4 days. Showers, please do not jump in the shower the day by yourself after you've taken medications. That's something that you don't want to do because you're not going to be able to maneuver. I would recommend someone be there with you, or just have some things on the side. I was a single mother at the time, so I just had all of my personal items on the side of my bed, on my nightstand, and I was able to keep myself under self-care while I was laying in the bed. Then in about 4 days, I was ready to get up and take a shower and be myself again. So I don't recommend anybody like having that kind of surgery and then going immediately back to work, because you do need to get that medicine and your pain management and all of that stuff together. So I would recommend you stay home for about 3 days, and then you can maneuver from there and figure out what you really want to do. For the first 2 days, you do need someone at home with you just to help you with little minor things like opening doors. That was my most horrible. Everything I had, like from my Airbnb to the hotel to the car to everything, he had to be pulled. You know what I'm saying? So that was like moving those muscles that's underneath the breast, and it depends too if he puts the implants over the muscle or under the muscle. So that makes a huge difference with a lot of your recovery time and what you choose to do. So you let him know that in your consultation. But as far as keeping the bra on, like right now, I don't have a bra on, and I don't like to wear bras. And as you can tell, this is just how I sit naturally, and I love it. I love it. I don't have to wear a bra. I don't feel misshaped. This is a natural. I have a 450 cc's. That is what they go by in measurements. They don't go by anything else like an amount. Is by cc's. Everything's measured by cc's. So I went 450 because I wanted to go natural with my own body. The scar is very minimum now, and I'm going to show you guys without trying to show too much, but that is the minimum of the scar there, and you don't really see it as bad, but they're beautiful. Like everything is perfectly shaped. I have no like heavy issues when it comes to my breasts or them being uneven or not the same size. Like as people were saying in my earlier comments, the first thing they were saying, I'm just trying to show you the scar, and the other ones, it's not there. But as I was telling other people, they were saying, oh, one is bigger than the other, which in fact it actually is. But you can't, at the time when they're healing and when they're dropping, one's going to drop before the other, so you're going to look a little crazy for a second, and then finally after those 6 months, they're going to be perfect where they're supposed to be. But it takes time for them. Once they heal and they've been put in place, they're going to sit up really high. So you're going to like sit underneath your collarbone for a little bit, and it's going to sit really high, and they're going to be really swollen. And then for the next week they're going to go down, but as long as you keep that bra on to keep it, to keep them together and keep them not flopping all over the place when you're sleeping. Every night you want to secure them, and that keeps them trained and also protects the implant that's on the inside. The implant you want to be able to have for at least 10 years. So if you are going to sleep on your stomach, or you're going to be doing a lot of manipulating, you want to be careful, and you want to keep that bra on, because those implants in the first few weeks of you healing can actually move underneath your arms. So just be careful with your movements when you do decide to go through or go forward with your breast augmentation. Other than that, no pain like that. Like, I was so scared and looking at all these girls' videos. And don't scroll through YouTube. I know I'll tell a lot of people not to scroll through YouTube on these videos, but if you have to scroll through, make sure you find mine and share, like, and subscribe to my channel. I'm going to be doing more updates, because a lot of people, they're scared about these breast augmentations, and they look at people and they're like, I wonder if she had, or does she always. I was a smaller girl before this, so this is actually what fits my body naturally. So you can't knock it, you know what I'm saying? You just got to go for it. And the one thing I did say, I was saying earlier to one of my girlfriends, was I did not have any feeling in my nipples for like months. It took months for that to even come back. And that was one of those things to where I was like, man, what is going on? Why don't I feel anything? And then a couple months later, that's when I could feel them again. I was like, okay. I called my doctor. I was like, is it normal for me to be numb on my nipples? Like, I can't feel nothing. And then sometimes every blue moon, I feel like these really sharp pains right up underneath the surgical area. But I think that's just the settlement of the implant itself, and it might just be settling into the breast and then building, scar tissue, so that's protecting that area. Other than that, I'm really happy with them. I am happy with them. I'm not a flashy girl, but when I do, like, step out, I step out. And me and the baby step out too. And girl, they beautiful.